Pop quiz number 104. Which finding indicates hypovolemic shock in an adult who's had a 15% blood loss? 1. Pulse rate less than 60 beats per minute. 2. Respiratory rate of 4 breaths per minute. 3. Pupils unequally dilated. Or 4. Systolic blood pressure of less than 90. And guys, the correct answer is going to be 4, systolic blood pressure of less than 90. So I want you to think about what's happening. This person's going through shock because they're losing blood, right? So those organs, your kidneys, your spleen, your liver, those vital organs that are supposed to be perfused aren't being perfused adequately, right? So they start to shut down. The body's going through shock. I want you to think about what's happening. Your body's going to try to survive no matter what. So those vital organs are going to start to compensate. So you're going to see blood pressure go down because obviously there's no blood, right? Blood pressure is a force that's being exerted against the vessel walls. So the more blood you have in the vessel walls, the higher the blood pressure because it's more force that's being exerted. The less blood you have because of something like bleeding, hemorrhage, right? The less force that's going to be against the vessel walls, the less blood pressure you have. So blood pressure is going to be down. Follow me. All right. Blood pressure is down. Guess what's not being perfused? The kidneys. And the kidneys are going to try to keep you alive no matter what. So you're going to see the kidneys start to shut down. The kidneys are going to shut down for 2 reasons. Number 1, the kidneys trying to hold on to as much fluid, make you hold on to as much fluids as possible because you're already losing it. That's number 1. And number 2 is shutting down so that can divert all of those vitamins, nutrients, minerals, oxygen that's being carried in the blood so it can be diverted back to important organs to keep you alive, such as your brain. All right, so those 2 reasons. So you're going to see urine output go down because the kidneys start to shut down. You're going to see H&H decrease. Why? The patient's losing blood, right? You're going to see that hemoglobin to go down. All right, you're going to see RBCs go down. Why? RBC is part of the blood. That's going to go down. Let me tell you what goes up. The heart rate and the respirations, your lungs and your heart, they're going to try to compensate. You're going to see the heart rate go up because the heart's going to try to compensate and push out blood that you're losing. Okay, so you're going to see the heart rate go up. Heart rate's supposed to be 60 to 100. You're going to see that number surpass 100, and you're going to see respirations go up. Respirations are 12 to 22. Why do you see the respirations go up? Remember, oxygen is being carried in hemoglobin, but hemoglobin is carried in RBC, which is part of your blood. So if you're losing blood, you're losing what? Oxygen. And so your lungs try to compensate by increasing the respiratory rate.